Hello and welcome to my channel. This is Isaac Simple and Real. Welcome so much to my channel. Kindly feel comfortable. Let us roll together to the end. This is Mkurugenzi Maish, Simple and Real. In this channel, we usually say you should have our slogan that usually says that being positive about HIV is not necessarily being HIV positive. And together, we can avert HIV stigma in our society. Thank you. This is our new season that we are now tackling. We are moving nicely. Our new season is sexually transmitted infections. We have already done episode 1, that was gonorrhea infection. We have done episode 2, that is chlamydia infection. Now we are on our episode 3. Our episode 3 is syphilis infection. Syphilis in Swahili is what we call kaswende in Swahili. Thank you. I know you have heard about this before, but we are going to evaluate it and we are going to discuss it more deeper so that everyone can be able to understand and so that we can be able to be responsible of our own health as we impact knowledge and also we change attitude and also we try to avert stigma about HIV in our society. Thank you. Kindly follow us to the end as we learn more about syphilis infection. In this topic of today, we'll be discussing what is syphilis infection, what causes syphilis infection, what are the modes of transmission of syphilis, various stages of syphilis infection and clinical presentation. We will also discuss prevention measures of syphilis infection, treatment and complication of syphilis infection if treatment is not met. Thank you. Kindly follow me to the end as we learn together. Thank you. This is Isaac Simple and Real. Kindly do not forget to like, subscribe and share. Thank you. To begin with, let us start by defining what is syphilis infection. Syphilis is usually a venereal disease that is usually caused by a spirochete bacteria that we call Treponema pallidum. Now, what are the modes of transmission? Basically, as we started our lesson today or our discussion today, we said that syphilis is a sexually transmitted infection. Therefore, the modes of transmission are the main one is via sexual contact. This involves sexual contact. It may be a vaginal sexual contact, anal sexual contact, or oral sexual contact. Then we have the in utero or transplacental transmission. This is the transmission whereby the bacteria from the mother who is pregnant is transmitted to the unborn fetus in the mother's womb. Are we together up to that point? Thank you. The other transmission is done by the injecting drug users, especially when sharing injecting equipment among each other. So whenever one of them is infected of syphilis, by sharing the injecting equipment, they transmit the disease amongst each other. The other, which is essentially very uncommon, is via blood transfusion. If the blood is not well screened for syphilis, one may get transfused a blood that is infected with syphilis bacteria. Thank you. Kindly remember to like, subscribe, and share as we continue learning more about syphilis infection. Now, we are going to learn the clinical presentation. And syphilis usually presents itself in 4 different stages. To begin with, let's start with the primary syphilitic stage. This is the basic syphilis infection that usually arises between 10 to 90 days of the inoculation of bacteria into a new individual. Usually, what happens when the bacteria gets into your body, at the site of infection, usually develop a lesion or a papule. This papule usually forms crater that usually erodes to form a flat base with rolled edges that we usually call a chancre. So, if the route of entry was vaginal, the chancre usually forms on the vulva. When it forms on both sides of the vulva, we call them kissing wounds or kissing lesions. If the bacteria was inoculated on your anus or in your anus during anal sex, the chancre usually forms in the anus or along the anal folds. If it forms along the anal folds, it usually infects both sides of the anal folds. So you will form kissing lesions along the anal folds or chancres along the anal folds. If it happens the infection or the bacteria was inoculated in your body via oral sex, the bacteria or the lesion is usually formed either on the tongue, on the upper buccal cavity or upper side of your mouth, or it may form on the oropharynx. Are we together up to that point? Thank you. During this phase, one thing that we have noted will develop is a chancre. This is what is noted, or a lesion that is noted at the site of entry of the bacteria. If it's the penis, it's the glans penis, you'll get a lesion or a chancre. We said a chancre is usually develops as a papule that is firm and non-inodulated. Then they forms a crater or erupts or excavates itself and forms a flat base with rolled edges. It is painless and it may form at the glans penis, that is the route of entry, if it's the route of entry, the vulva, the anus, the oral cavity, or the tongue, oropharynx, or upper side of the mouth. And also, if the route of entry is the finger, it may also develop on the finger, but this is a bit rare, not very common. Also, at the route of entry, the patient also develops lymphadenopathy or enlarged lymph nodes. So, if it happens on your genitalia, you will have enlarged inguinal lymph nodes. Inguinal lymph nodes, these are the lymph nodes that are found between your legs. The lymph nodes that are found between your legs. If it happens on your mouth, the lymph nodes around your mouth are the lymph nodes on the Wade's ring. Wade's ring is usually found along your neck. That is the tonsillar lymph nodes. They will get enlarged. They may be tender or non-tender. Then we go to the secondary syphilitic stage. During this stage, the patient becomes more clinical and usually happens between 2 to 10 weeks after the initial phase of the primary syphilitic stage has developed. It is usually characterized with the macular lesions on the trunk and the palms and the soles of feet, and these lesions may be papular or macular. Papular appears like rashes. Macular appears like discolorations, circular discolorations, either darkish or pinkish for the light skins. They are usually painless but infectious. However, they may become pustular, or they may develop pus if they have secondary supra-infection by a secondary bacteria. The patient also, during this secondary syphilitic stage, may also develop acute syphilitic meningitis, that is involvement, the bacteria progression to the meninges, whereby the patient presents with headache, neck stiffness. They may also develop weakness, or weakness maybe of any organ, maybe extremities, or maybe facial palsy, kind of weakness. May also develop partial hearing loss during this kind of acute syphilitic meningitis. The patient may also develop severe bone pains, or bone pains, especially during the night. May also develop arthritis. The patient may also present with general body weakness. We also call it general body malaise. These are some of the symptoms that patients exhibit during the secondary syphilitic stage. Now we go to the latent stage. The latent stage is usually divided into two. We have the early latent, and then we have the late latent. The early latent is characterized by a regression of the symptoms of the secondary syphilitic stage. The patient starts recovering from the secondary syphilitic stage during the early latent phase. It may progress up to 6 months of the early latent phase before the patient progresses to the late latent phase. The late latent phase usually stays a bit longer, and it can stay even up to 10 years. However, it finally comes. How does the late latent phase present? This develops with complications following the prolonged syphilis infection or syphilis presence in their body. What are some of these complications? These complications are some which progress to tertiary, and which we shall combine with a presentation of a tertiary syphilitic stage. One of the complications is patient may develop deafness or loss of hearing. The other complication, patient may develop some things that we call rumors. Rumors are granulomatous lesions that usually develop under the skin of the patient. Patient may also present with some finger-like projections that usually have a diameter of about 2 to 3 millimeters, especially around the genitalia, but we call them condylomata lata. They are a bit different from condylomata acuminata in that they are a bit smaller. Are we together up to that point? Thank you. Now, these swellings or inodulated swellings that are usually developed along the genitalia, the external genitalia, we call them the condylomata lata. They are usually pathognomonic or they are diagnostic of syphilis infection. Patient may also develop other general presentation that are non-specific to syphilis, like they may develop bone pain, arthritis. They may also develop weakness, that is, can lose. They may lose the power, maybe of their hand or their limb, any of their limb. They may also present with paresthesia, that is following brain involvement. And those are some of the presentations of the tertiary syphilitic stage. Now, how about prevention? How do we prevent syphilis infection? For those who are injecting drug users, we usually recommend them not to share injecting equipments like needles. This is usually facilitated, especially by some non-governmental organizations, by providing them with free injecting equipments for those who really cannot be able to be withdrawn directly from these injecting drugs. Now, for a person like you and me, if you are having sex with a person who you do not know their STI status or HIV status, it is always wise for you and me to use condom. If you are male, use male condom. If you are female, use female condom. This will prevent you from getting infected HIV. At the same time, it may prevent you from getting unwanted pregnancy, and at the same time, it will prevent you from getting syphilis, because we said the primary site of infection usually is via sexual contact. That is the most common. So if your sexual partner has a chancre, maybe at the glans penis, you'll be protecting yourself by using condom, because the lesion will already be covered. The other thing is, for those who are infected, it's always good to get early and prompt treatment. Remember, we can be able to prevent spread of syphilis by treating those who are already infected. Also, for any pregnant mother or pregnant woman, it's always very necessary for you to be tested for syphilis when you are pregnant. This is because syphilis can be transmitted in utero or can be transmitted transplacentally. So to avoid you transmitting syphilis to your unborn child, it's always wise for you to be tested and to be treated early before you transmit the same infection to your unborn child. And then the child is born with abnormalities. Are we together up to that point? Thank you. Thank you for watching my channel. Now, the next thing I want us to discuss is about treatment. How do we treat syphilis? Syphilis, we said, is a bacterial disease and it is usually treated using antibiotics. Usually for the primary and secondary, we usually treat it using benzazine penicillin injection that is usually given 2.4 mega units as a start dose. You just get one shot and you are done. For latent stage and tertiary stage, we usually treat it with 3 doses of 2.4 mega units that are usually given on weekly basis. So that is 7.2 mega units given in 3 divided doses on a weekly basis of benzazine penicillin, not procaine penicillin, benzazine penicillin. For those who react to penicillin, there is also an alternative. You can be able to prescribe azithromycin, usually given 2 grams as a start dose for those who are with the primary and secondary syphilitic stage. The research shows that a dose of 2 grams of azithromycin is equal to 2.4 mega units of penicillin G. So thank you for watching my channel. Thank you for your continued support. Kindly do not forget to like, subscribe, and share to your friends. Let more people be able to learn about this channel. And also in our community, remember that being positive about HIV is not necessarily being HIV positive. So together we can be able to avert HIV stigma in our society. We can be able to embrace our colleagues who are HIV positive, and also we can be able to create more awareness about HIV and be able to live positively either with or without HIV. And we can also be able to prevent sexually transmitted infections in our society by treating those who are infected, by preventing those who have not yet gotten infected, and also being able to know what to look for to seek help in case you're suspecting you having sexually transmitted infection. Thank you for watching my channel. Thank you and God bless you. Kindly do not forget to like, to subscribe, and to share. This is Mkurugenzi Maish. Bye bye.